Hello, everyone. Today, I thought I would give a short lecture on the topic of yin yang pulse diagnosis, which is a feature of an up-and-coming series of lectures uh, that will be offered through the Academy of Source-Based Medicine's website on Thinkific. The course is called the Shanghan from Theory to Practice. And yin yang pulse diagnosis is an aspect of some of the training we do in this course. But it's interesting because it's also come to sort of dominate a lot of my clinical thinking, a lot of the way that I approach the Shanghan Lun, thinking about it both from a pathomechanistic standpoint and also just a clinical standpoint. So I thought I would introduce the system today and talk a little bit about its strengths, how it's different from or similar to other systems, and also specifically this idea of identifying the unique pulse, which is sort of at the core of this system, but also many other systems as well. So where does this idea of the unique pulse come from? In the Su Wen, or in the Huangdian Jing, the idea of this, the word unique, I'm translating from the word du, which could also mean maybe exceptional or solitary. Probably wouldn't be as good. I think unique is a good translation for this pulse. And so this idea actually starts much further. It starts before the Shanghan Lun. And it's a very important aspect of pulse taking in the Huangdian Jing, or the Yellow Emperor's inner canon. So in Suan 20, we see it says, when examining the nine indicators, for those who don't know, it's referring to pulses at different places on the body, namely on the head, at the, we say sort of at the temple, in front of the ear, and on also at this point, and then on the tsunko, or on the hand, we have three pulses here that we can identify, three on the head, and then also three on the foot. This was the nine indicator system that was used before in sort of what we could call like the classical acupuncture system of the Huangdian Jing, or the inner canon. So it says, when examining the nine indicators, a uniquely small pulse indicates an illness, a uniquely large pulse indicates illness, rapid pulse indicates illness, slow indicates illness, uniquely hot above the pulse area indicates illness, or cold, or a sunken pulse. All of these indicate illness. So the idea here in this system was that prior to doing acupuncture, the acupuncturist who practiced using this nine indicator system would feel on the various pulse positions of the body. So again, feeling on the pulse positions of the head, on the hand, and on the foot. And they would be looking for one pulse that was particularly strong, or particularly weak, or like we say, rapid, slow, hot, or cold, right? Then based upon that, they could then diagnose that there was an illness in a particular channel, or in a particular part of the body, right? And then the treatment would then be to actually needle at that area. So for instance, if they felt there's a particularly strong pulse, let's say at the tsunko area, like the place that we normally like to feel for pulse now, if there was a stronger pulse there than anywhere else on the body, then they would know to needle at that point. Or if it was on, for instance, at the Hugu area, sort of like on the Yangming channel, they would know to needle at that point. And the idea would be, for instance, if it was strong at, let's say, like at the Hugu pulse point, they would use they would be draining there. They'd be using a draining technique, either literally bleeding at the pulse, or using a draining technique, right? And vice versa. If it was particularly weak at that point, then they would try to use a supplementing technique at that area. Now, if it was sunken at that area, they might use moxibustion as well, would be another technique to use. So this was a very, very important technique and a diagnostic system in ancient times, in what we call the sort of the classical era of Chinese medicine. And actually, even prior to the Neijing, we can see that this was, in fact, the dominant system. So, for instance, Chen Jianguo, who is a modern acupuncturist, said, in ancient times, we see evidence of doctors using this unique pulse identification diagnosis. So in ancient times, no doctor was more skilled than Cang Gong at this form of diagnosis. In his case studies, he always identifies the unique pulse and then uses a few herbs or 1 or 2 needles to treat with immediate effects. So Cang Gong being Bian Que, who we know is sort of this famous sort of classical era, acupuncturist, right? And we actually, Chen Xiaohui is able to say this because we have access to the cases of Cang Gong in the classic of history, right? And so we have many of his cases recorded in there. It actually turns out that the method that he uses is to look for the so-called unique pulse, the pulse that's different from all the other pulses on the body, whether that be looking at the pulse points of the 12 channels, right? Or looking at, again, like we just saw, using the 9 indicator system, right? And so we see that this tradition goes way back, potentially even before some of the writing of the inner canon itself. And then, as it turns out, it continues onwards into the treatise on cold damage. So what was originally sort of a pulse method or a diagnostic method that was used primarily in acupuncture was then also implemented in the use of herbal medicine as well. So Ruqi, who is sort of like probably the authority for Shanghan, or what we could call a sort of Jingfang pulse, in terms of study, in terms of his research into this field as a scholar practitioner, he has this to say. He says, unique pulse identification diagnosis is the key to the practical use of Cunko pulse diagnosis. So right away, this is already, we can see something different here, right? We were just speaking previously in an acupuncture context of unique pulse identification in terms of 9 indicators, right? Pulses on the head, in the hand, in the foot, or in the 12 channels, the pulse points. But here we're looking at Cunko pulse, right? So there's been a metamorphosis over time. And he says, the treatise on cold damage states, replete pulses can indicate disease, as can vacuous pulses. Evil does not manifest in the pulse arbitrarily. It is always a sign of pathology. Examine for signs of exterior or interior pathology and differentiate the position in the 3 burners. So Ruqi is going to go on to say this statement is similar to what Zhang Jingyue, a Ming Dynasty doctor, says, is that evil lurks in the unique pulse, right? So if we look at this, he's looking specifically at this line here where it says, evil does not manifest in the pulse arbitrarily. It is always a sign of pathology. So it's saying that unique pulse, wherever it is, on the Cunko pulse, on the radial pulse, wherever it is in one of those positions, it's always a sign of something. It's always something that you have to pay attention to very specifically, right? And so he says the key to the unique pulse identification diagnosis system's ability to deduce the yin or yang nature of disease, identify the site of illness, and the pathomechanism is in its identification of uniquely replete or vacuous pulses at the 6 pulse sites of the Zhongkou pulse. So he's saying within Jingfang pulse methodology, pulse system of Jingfang, we're looking, what we should be looking for is a replete or vacuous pulse that's uniquely replete or vacuous. And that is what is going to be the key to help us understand a patient's pathology, to understand how to differentiate their illness in terms of yin or yang, and to identify also the site of disease, right? Now, the question then becomes, what is a replete pulse? What is a deficient pulse, right? So if it's so important, if it's going to help us identify so much about a patient's illness, we need to understand what it is, right? Now, Ruqi is going to look at one particular line in the Shanghan Lun, the treatise on cold damage, to help us understand this. This is going to be his interpretation. So he looks at a line that says, in the treatise on cold damage, large, floating, rapid, stirring, and slippery pulses are considered yang pulses. This is according to the treatise on cold damage. Sunken, rough, weak, wiry, and faint pulses are considered yin pulses. Now, Ruqi is going to go on to say then that replete pulses are yang pulses and vacuous pulses are yin pulses. Okay, so when he is practicing this, what we call unique pulse identification diagnosis, he's going to be looking for a pulse among the 6 positions that is either replete or vacuous, uniquely replete or vacuous, different from the others, and that's going to be a pulse that's has a certain quality to it that's unique from other pulses, right? So of the 6 pulses, one of the pulses is going to be uniquely rough, or it's going to be uniquely thin, or uniquely wiry. That is going to be what allows him to identify that as the one unique pulse, right? Or it could be 1, 2, or even 3, right? And once we identify that, what do we do? Well, then we zero in on it. That becomes the focus of our treatment. And we look at that as being the primary pathology, oftentimes what's called nowadays in China, the primary contradiction of disease, okay? So again, for Ruqi, that's going to be a question of the quality of the pulse, a unique quality. Now, Ruqi is someone that I look to a lot in my understanding of pulse, but he's not the person who I've learned from primarily, and that's going to be someone named Chen Jianguo is who I learned from, and he has a different approach. He has a different approach to this understanding of so-called replete and vacuous pulses. So for Chen Jianguo, a replete pulse, to put it bluntly, is just about strength. So he says, compared with a regular pulse, the pulse is stronger or the vessel is wider. That's a replete pulse. Or of the 6 pulses, 1 to 3 pulse positions are stronger or wider than the other position. So basically this means a unique pulse that is replete is going to be either stronger than your average pulse, or it's going to be stronger than the other pulse positions, right? And now conversely, a vacuous pulse is going to be weaker than your average pulse, or it's going to be weaker than the other positions. And so looking at that, he's going to feel on the positions for those pulses. That's what he's going to be looking for, because that's the so-called unique pulse, right? Which, as we've seen from the very beginning, is going to tell us where the site of pathology is, where the we could say the primary pathology is in a disease, whereas what ends up being upright qi clashing with evil, right? That's what this unique pulse is telling us. So just to give an example in Chen Jianguo's system, this would be his representation of a Wuju Yutang pulse. So as you can see, he has this pulse. This is the left side pulse, marked out with strength, with different strengths. So a red pulse is a strong pulse, a stronger pulse. Blue represents weaker. So in this, you can see the strongest pulse is represented by this big dot here, which is on the left cun in the middle position, the left cun. And then also there are strong pulses at the floating position and the sunken position, the deep position, I guess is the best word, of the left cun. And then also at the middle deep position, the guan deep position. Now, on these positions up here, it's actually weaker than so-called average pulse. So this is, so if we had to say, where is the unique pulse? Where's the replete, well, yeah, where's the unique pulse in this pattern, in this Wujutang pulse pattern? We would say that the really unique pulse is here on the cun, at the middle position of the cun, right? Now these are also unique, but they're this area is sort of, you could almost say, is all unique, but then this is the most unique, right? Now, again, like we said, this is a replete pulse. Unique pulses can either be replete or they can be vacuous, uniquely replete or uniquely vacuous. So what does this represent? Well, it sort of represents two things in this particular case. One, it represents where evil is located, right? In this case, we have a cold room. Now that's located at this middle guan area. Sorry, this deep guan area, right? Deep representing in the Jingguo Yaliyue, we know that room is often represented in the pulse as being deep. Now also it's deep and cold. So deep and cold representing often manifesting at this deep position, right? And then also the fact that it's at the guan, meaning it's in the middle burner. If we look back at the quote from the treatise on cold damage, it says, examine exterior or interior and differentiate the position in the three burners. So in the Shanghan Lun system, location is also represented in terms of the three burners, right? And so that's another aspect. Now, there's also this aspect of the pulse, which Chen Jianguo will say is upright qi's response to the evil. So we have the evil itself, sort of represented here. Then we have upright qi's response to the evil. Upright qi is trying to push the evil outwards. And so that's why we have for instance, a Wuju Tang pattern, we have vomiting, we have headache, we have maybe distension in the eyes or in the head, right? And so this all manifests in the pulse as well. But because it's not an exterior pattern, it's just vomiting, headache, these kinds of things. It's not in the cun, it's not in the floating position, it's in the middle position. That's why we have the middle position being the strongest. It can also be in the overflow pulse or the roll-up pulse. So as you'll notice in this analysis, we're not going into a deep analysis, but just to give people an idea, the focus of his diagnosis is on finding the strongest or the weakest pulse. Is there also some discussion of pulse quality? Yes, especially when you get into differentiating between similar pulses. Like maybe there are other pulses that have this a similar pattern to this in terms of their sort of their strength profile. But the number one thing is to first look at strength, because the strength tells you what's unique. And what does uniqueness tell you? It tells you where upright chi is being where sort of the body, the shen, is trying to invest its upright chi, where it's delegating upright chi in the body, because that tells us then where we should be focusing our treatment, right? If the body is delegating upright chi to the middle burner and the upper burner, and trying to push outwards, and you use a method that tries to purge or to drain the lower burner, then you're going in the completely wrong direction, right? And this has to do with again, the left and the right pulse and descent, ascent. We're not getting into all of the specifics right here, just to give people an idea of the focus of the system. So why the emphasis on strength? Like I say, strength indicates where upright chi is devoting resources, or conversely, where not enough resources are devoted. Now, this helps us to prioritize strategies, right? Sometimes we have very complicated pulses. There's all different kinds of qualities going on in different parts of the pulse. Maybe we have a very complicated presentation of disease as well. The person has a lot of different symptoms. By looking specifically at strength, it helps us to prioritize where we should first be orienting our treatment. That's what, and it helps to simplify the treatment too. So oftentimes, Chen Jianguo will give the example of line 91 in the treatise on cold damage, which says when there's heat effusion, headache, but the pulse is sunken, if it does not recover and the body is in pain, you should first treat the interior using Sinitang, right? And so it shows you that, for instance, you have all this line. What it tells you is you have this presentation of exterior pattern, but then you feel the pulse, and the pulse tells you there's a uniquely vacuous pulse. The pulse is uniquely vacuous, specifically in the Chen Jianguo system being the right shi. Well, that tells you the first thing you need to do is to devote resources to the area that is uniquely diseased, right? Which is the right shi. Notice that pulse, it doesn't have a floating pulse on the left side, which would then tell you that the body is devoting resources to pushing outwards. It's not. All of it has this lack of resource in the right shi. And that means that before you can even think about resolving the exterior, the first thing you have to do is to supplement the interior with Sinitang. And so it's this idea of, by focusing on strength, by focusing on the unique pulse, you can easily strategize and prioritize your treatment and know exactly what to do first, second, third, right? So now we're going to look at just a case. This is a case that came up recently, actually in the Patreon group, the Academy of Source-Based Medicine Patreon group. And so this is a Chen Jianguo case, and the chief complaint is fatigue and shortness of breath. Now, the patient was diagnosed with hypertension 10 years ago and the highest recorded pressure of 200/110. Even with medication, her blood pressure still tends to trend high. She feels tired all the time, has shortness of breath. It's a female, I should have noted. On slight exertion, she claims urine and bowels are normal and has no problem eating colder foods like fruit or cold drinks. She dislikes drinking water and sweats very seldomly. Sleep is normal. and she has pronounced aversion to wind and cold. Now, the left side is sunken and slippery, but it has an overflow pulse. And then you see there it's denoted with 1, 1 being strength. The strength can be from 0 to 2, 2 being strongest, 0 being normal. None of the left side pulses stand out in terms of strength or size, despite having notable qualities like sunken and slippery. Now, the right side is generally wiry and has an overflow in our right 2. This is because it has the pulse is engorged. You can actually see it in plain sight, and you can see it beating, which is an automatic 2 or strongest pulse. Now the right guan is particularly strong, slippery, and it's a 1.5, so close to the very strongest. The pale is red with pronounced teeth marks, pale red, slight thicker coating, and white at the back. Now, Chen Jianguo uses 木方鸡汤去死高加茯苓芒硝汤, right? And he says if there's more than 3 loose bowel movements, then decrease the dosage. Now, how does he come to this decision? Well, this is what I think is interesting. He is looking at the unique pulses, the strongest pulses, the pulses that stand out from the other ones in terms of strength, right? And so in this case, that's this overflow pulse on the left side, overflow on the right side, and slippery guan pulse, strong guan pulse, right? So now he's just going to focus in on those 3 places and devote the resources of the formula, the treatment, to resolving the pathomechanisms that these 3 places represent. And so what's interesting about this is you might say, well, what about, for instance, on the left side, the pulses are sunken and slippery. Certainly that means something. Certainly that's something that should be addressed, right? All of the pulses on the left side in this case were strong. So you might say, well, they're strong. That means they're unique, but they're not unique because all of them were strong. They were all the same amount of strong, right? And so that means that they're not a unique pulse. The only unique pulse on that side was the overflow pulse, because an overflow pulse is always notable. And so this helps us narrow things down. We can essentially say, well, none of those pulses are really standing out on the left side. So that means that the upright qi is not particularly devoting resources to that. That's not the primary site of engagement, of conflict in this pulse. It's in those places with the strongest pulses, the overflow on the right side, left side, and on the right guan. And so this then helps us to make our decision. The overflow on the left corresponds to an exterior pattern. That's why you need to use, in this particular formula, he uses guizi, right? So he has guizi at 15, right? Sorry, GZ here is guizi. And then the overflow on the right is a counterflow, which is treated with mangxiao in this case. And then this slippery right guan is treated with fangji and also mangxiao to a degree. So without going too much into detail, it just shows us how immediately when you use this particular method, it prioritizes what you need to do first. There's a lot of different information coming at you in the pulse, but this allows you to make your decision and set your priorities in the case, right? Now, let's just do a counter study of Ruqi, who is another very good practitioner, very good Jingfang pulse practitioner. But like we said, he focuses on quality. He says a replete pulse will tell you, will manifest in quality. Now, he says left twin floating. This is an infertility case, 34-year-old woman. The left one floating and slightly slippery. Guan wiry and slightly slippery. Chi wiry, thin and slightly slippery and tight. Right one floating and slightly wiry. Guan slightly wiry. Chi thin. Tongue is pale red with a light white tongue coating, right? So he diagnosed this as Jian disease with a Guizhi Fuling 1 plus Yuju 1 pattern. And his analysis is the tightness in the Chi can be a sign of blood stagnation. Use Guizhi Fuling 1. The left and right guans are wiry and the left guan is slippery. This can be a sign of qi, blood, and phlegm stagnation. So the problem with this is that it's when you're feeling these different positions, it's much easier to feel for strength first than and the width of the vessel than to feel for different qualities of different positions. And there's so much to parse through in this pulse, right? If you're just looking at this pulse right off the top, it doesn't immediately give you a direction. The only thing you can say is that he said that this pulse is slightly tight, right? Now, the other places don't have tightness. And so according to his model, this is a unique replete pulse, right? A tight pulse is replete in his system, and it's the only one that's tight, so it's a unique pulse. So you need to focus on it, right? But in terms of how, he's looking at wiry pulses, right? On the left and right one, but we also see that there's some wiriness in the right one, right? So there's some slipperiness again, for instance, in the left one. And then there's also this floating. What do you do? The floating is also unique, right? So how do you choose? It's a little bit more difficult to choose in this situation. What is the thing to focus on, right? And so that's what I like about the Chen Jianguo system. Is it perfect? I don't think so. I think actually it could use a little bit more focus on quality. Although there is some focus on quality, it does focus a lot on strength. And so in the program, in the training for this Thinkific course, we do look also at Ruqi. We look at some other sources that talk about pulse. For instance, also we look at Lo Shaokun, or we look at Wu Xiongzi, for instance. But we focus on Chen Jianguo because this idea is very, very helpful, not just for pulse diagnosis and designing treatment, but also in understanding pathologies in general. Understanding how a pathology is about where upright qi is devoting resources in the body, and where, again, as a result of devoting those resources, other areas become deficient as a result. This is something that's really influenced, my thinking over time. And I hope that I can share this with people, and other people will start to adopt this system as well, because it's a very good system. And so that's all for today. Thank you for listening, and I hope you'll check out the new course, the Shanghan Lun from Theory to Clinic, offered through Academy of Source-Based Medicine's website on Thinkific. Thank you.